and just listen. You know, a lot of things in business, just as a business person, we become better by listening and not just chasing the dollar. And though, you know, I don't treat dollars, I treat people, and then the dollars will come.
Hi, everybody. Welcome to the podcast. My name is Antonio the Miles. And yes, this is the Empire Podcast. And today we have a special, wonderful guest, a beautiful woman, entrepreneur, and yes, a dentist. I know something new today, you guys. And so I just want to introduce you to Miss Dr. Joi. Hi, Dr. Joi. Welcome to the podcast.
Hey, thank you. How you doing today?
I'm doing great. It's a beautiful day. How you doing?
I'm doing great. It's great here in Atlanta, sunny skies outside, so it's all good.
Okay, so the weather's okay in Atlanta today?
Beautiful, yes, and I'm inside.
Uh-huh. You got a window though, right?
Somewhere around here, I find it.
Okay, it'll show up. It's interesting you mentioned Atlanta because we keep hearing that Atlanta is like they call it like the Black Mecca,
Mm-hmm.
right? Would
Yep.
you agree?
Yeah, I'm born and raised here. I have seen it evolve from nothing to what it is now, and it's true. It's true.
Wow.
It's true.
Wow. Hopefully we can get some more cities in America to be just like
I
it.
hope so. I think it will be. It's just it starts with an open mind. Just do it.
I agree. I agree. So Joy, so for people who don't know who you are, can you please tell us who you are?
Sure thing. Well, I'm Dr. Joi Freemont. They call me Miss Doctor Lady. Like I said earlier, I am from Atlanta, so they call me an ATLian, originally from here. I have been a dentist now for 25 years. I went to undergrad at Southern University in Baton Rouge, Louisiana. That's an HBCU. I am in love with my HBCUs all across the country. I got my dental degree from Marquette University in Milwaukee, Wisconsin. And immediately upon graduation, I came right on back home to Atlanta, opened my practice, and have been doing it ever since. So I love being a dentist. I love what I do. I do more things as well, but my main money makers are these fingers, these hands, getting in those mouths, being a dentist. So that's what I love to do.
I love it. I love it. And I always like to ask people this because, like you right now, you're a dentist, right? But can
Mm-hmm.
you give us and me, of course, can you give us all like a quick origin story about, Joy as a child to like how she got to where she is today?
Okay, well, my dad actually was a physician and he was OBGYN. And growing up, I saw him with, well, they call them pagers. People don't even really carry them anymore, but we called them beepers back then. And as a physician delivering babies, he delivered babies all of the time. So I don't care where we were, if his beeper went off, he had to go. I always loved science. I knew I wanted to be a doctor, but seeing him having to rush off so much turned me off from that. So I knew I did not want to be a doctor that had to have a pager. So I stayed in the dental chair a lot. I have lots of fillings. I have everything done in my mouth that you can imagine, extractions. I had braces forever. And I always enjoyed it. I had no problem going to the dentist. I said, you know what? I think I want to be a dentist. So early on, I always wanted to be a dentist. I just kept that dream in my mind, and that's what I wanted to do. That's what I did. So following my dad's footsteps and being in the medical healthcare field, I changed from being a physician, a medical doctor, to being a dental doctor. So that's what I do.
Did it happen? So basically, you said you wanted to be in the doctor field because of your father, right?
Mm-hmm.
But how quick did it change from, okay, I don't want to be a physician, I want to still be a doctor, but not a physician? How quick did that change
It
happen?
was always dentistry for me. I always actually want to
Okay.
be an orthodontist. And so I actually do braces as well. So I'm a general dentist who does orthodontic treatment. So I had a dream back when I was 8, 9, 10 years old, and I stayed with that. So that's me. I had it in my mind from a child, and I followed the whole path all the way up.
I love that. I love that when the childhood dreams come true. It's
Mm-hmm.
fulfilling, I'm assuming,
It is. It
right?
is very fulfilling.
Okay, so we know why you became a dentist. So obviously you said you do braces and then you do like, so for people like even myself and other people who may not know, like what type of dentistry do you do? And what are the other types of, I guess you can say, dentistry are there?
Okay, so on paper, they will call me a general dentist. So as a general dentist, I do basically everything, which goes from fillings, I do cleanings, I do gum treatment, I do extractions, which means pull teeth, I do root
Oh,
canals, I do veneers, I do crowns, I do bridges, I do partials, I do dentures, I do cosmetic work from bleaching. So the gamut is everything all day, every day. It's almost like going into an ER, going to the emergency room. Whatever comes in my chair, I can really do it. As opposed
wow.
to if you're a specialist, you really can only do that one thing. Like if you're an oral surgeon, you would basically do surgery, you would do extractions, things like that all day, every day. As a general dentist, I can do everything and then refer out the things I don't want to do. So that's the luxury of being a general dentist. If I don't feel like doing it, I'm like, you know what? I don't want to do that today. I'll find a specialist who can do that and then I can refer that out. But if I want to do it, I do it. So that's kind of it's almost like a luxury because if I just don't feel confident in doing it, if I don't feel like doing it, if it's too complicated for me, if I don't have time to do it, I can actually refer it out. So as a general dentist, I have the ability to refer out if I don't want to, or even if I can't do it. Because some things are kind of complicated and I just don't want to do it. So I just send it out to
Got
those who
you.
will. Mm-hmm.
Got you. So, as a general dentist, I'm assuming you know who Kanye West is, right?
Yes, I do.
Um, yeah, he got into a major car crash and he had to get his mouth wired shut.
Mm-hmm.
So, would that be something that you would do as a general dentist, or is that a
I
different
could. I've
specialty?
done it before. So Kanye had a car accident and he had his mouth wired, and then I think he ended up getting partials. I mean, he lost several teeth. So
Mm.
if Kanye would smile really, really, really big, you could see some of his teeth that aren't his. To the naked
Ah,
eye, you wouldn't really see it. I can see it from a mile away, but his dentist did a very good job. I'm not knocking it at all, but that's something that's done by an oral surgeon. So he probably had to go into the hospital, and the surgeon actually probably came to the hospital and did the operation right then. So that's the job of an oral surgeon.
wow. And is there are all the pay levels like the same for like the dentistry, like oral surgeon, orthodontist, general surgery? Is it kind of all like the same pay range, would you think
They
or
go up
assume?
and down, and then it depends on where you live as well. Honestly,
Ah,
and I would say this, not trying to be funny, but I really stay in my lane, meaning because I do so many different things, I can probably make a lot of money, which I do. So because I do things that most general dentists don't do, and I also do sleep apnea treatment, and I also do braces as well. So you can imagine an orthodontist salary plus my salary plus the sleep apnea salary all rolled into one. So I do a lot of treatment that brings me a lot of financial benefits. Let's say that.
I love it. I love it. Is sleep apnea anywhere related to like dentistry? Is that completely different
So
field?
sleep apnea is an area of dentistry that's not necessarily dentistry. It's actually a medical. Uh, Sleep apnea is a medical disease. Okay, so
Hmm.
as a dentist, I can treat it. I'm actually a diplomat in the American Board of Sleep Dentistry. So that's a whole other field. And I'm actually the first African American to receive that status. So
Congratulations.
thank you very much. So what happens is a dentist can work with a sleep dentist. I'm sorry, a sleep physician, which is called a pulmonologist. So we work together. So if
Okay.
someone has sleep apnea, they normally know they wear the Darth Vader mask, right? The big CPAP. So you probably
Hmm.
heard of the CPAP before. Well, most of my patients who don't want to wear the CPAP, I make them a custom device that goes in their mouth that they can use instead of using the CPAP mask because it's more convenient. Um, and it's not, the CPAP mask just ain't cute. People just don't want to wear it. So unfortunately, people who have sleep apnea and they don't want to wear the CPAP, they don't do anything. And then they end up dying. That's just the honest to God truth. So my thing is to
Wow.
the doctors, what are you doing for your patients who aren't wearing the CPAP? Are you following them up? I mean, what's happening? So if they're not getting treatment, send them to me and I'll give them a custom mouth appliance. So that's where I come in.
That is amazing. And two questions, Joy. Can you explain a little bit for people who don't know what sleep apnea is?
Right. So sleep apnea in the short story is basically you stop breathing while you're sleeping. There's something that's blocking your airway while you're sleeping, and that's what's called obstructive sleep apnea. So most of the time your tongue is enlarged and it falls back when you sleep. Your jaw falls back when you sleep, and that blocks your airway. So when people snore, for instance, people think snoring is normal. Well, snoring is not normal, it's just very common. And what snoring is the sound of the air that's being trapped inside of your nasal passages in your mouth, and that air can't go anywhere. That air should go through your nose and down through your airway. But if it's blocked up here, that sound is because that air is trapped inside of your airway and it can't go anywhere. So like if you're breathing right now, you're talking to me, I don't hear you snoring because your air is flowing properly. But if something's blocking your airway and that area is from large to small, that air is trapped. So all that air can't go anywhere, it's stuck. That's what snoring is. So sleep apnea is the science, but not the science, the condition where the air is trapped, something's blocking you from breathing, and then it's closed, so you can't breathe. So people don't just quote unquote die naturally in their sleep. They die from heart attacks because their heart won't get oxygen. The oxygen comes from the air you're breathing. Well, if you don't get the air to your heart, you have a heart attack or a stroke when you're sleeping, hence the quote unquote natural death, which is not natural.
Wow. And then so you would create a custom device that they would put in their mouth when they go to sleep?
Exactly. So the mouthpiece actually brings your jaw forward. And when your jaw comes forward, your tongue won't fall back either. And that way you can breathe your own natural air versus having that mask over your face that's plugged up. And that's breathing for you. You're breathing your own natural air. It's custom made for your mouth. And then you can breathe at night. Yep.
I like it. That's super cool.
Yeah, it is. It's really cool. Mm-hmm.
Got you. And like, would they have to sleep on their back to have it, or can they?
No, actually you don't. So what I like about it is you can sleep on your head if you wanted to. The drawback about sleep apnea and the CPAP is over your face. So unfortunately, it restricts your movement because it's strapped to your face, and you can turn left and right, but you can't. Like imagine if you're a stomach sleeper, for instance, you normally sleep comfortably on your stomach. You can't do that with the CPAP because it's blocking you, right? So the mouthpiece fits in your mouth and you can do whatever you want to. I myself have sleep apnea, and I carry my mouthpiece on the plane when I'm flying somewhere because your body has no idea where you are when you're sleeping. It knows that you're asleep. Like if you have diabetes, I don't care if you're in America, if you're in Africa, you can always have diabetes, right? So if you have sleep apnea, I don't care if you're in your bed or on the beach, you're going to have sleep apnea. So you have to have something keeping you breathing. Who's going to have a CPAP on the beach? Nobody, right? So you can throw that mouthpiece in. It's no one can see because it's inside your mouth completely. No one sees it, and you're good to go.
I really love it. That is such a cool, super cool thing.
Yeah.
Wow. I bet a lot of people never even heard of sleep apnea.
Exactly.
And if they have, they probably never heard about having a custom device being available to them.
Exactly. So I do a lot of speaking. I do a lot of speaking, especially to my physicians, saying, hey, if your patient can't wear your CPAP, please give them the alternative of something different. Just don't let them just not have anything because they will die. That's just the truth.
Wow. Yeah. And sometimes the hard truth is the best truth.
Exactly.
Yeah. So, you're one of the first dentists, Joi, that I ever heard talk about CBD.
Okay. Right?
Okay. And you're one of the first dentists also that I heard talk about STDs in the mouth or like viruses in the mouth. Like, your unique take is like, where does this come from that you want to share all this information with people?
It's because people talk about it and they don't want to talk about it. It's like, it's here. I mean, it's a reality of it. So why not discuss it? So I'm the person that they come to and I give it to them real. Like I provide CBD for my patients, one, because no one likes to come to the dentist. So if I can relax you any way I can legally, let's get it done. So I started doing the CBD primarily for me, because as a dentist, as a business owner, I'm high strung as it is already, and I needed something to calm down. So the CBD that I provide does not have any THC. I'm not against it. I just don't particularly use it. So I need something for myself to reduce my anxiety. So I actually use it for a whole year before bringing it to my patients. And so when I realized the benefits of it and how it can help my patients overall, I started providing it for my patients. And the ones that have very high, what we call dental anxiety, meaning they're scared of coming to see me, we give it to them before they come, and they're a whole different person when they get back in my chair. So by seeing that transformation, I started providing it. So that right there was one thing. And then as far as the STDs, I mean, when you have an STD, it's not just down there. I mean, it's in your body, right? And I see it. So like, I got to talk about it. So people like, no, I don't do anything. Yes, you do. So my thing is just not that I'm telling your business, but when I'm with you in the chair with one-on-one, even though I'm not your physician, I am your healthcare provider. So understand, be honest with me, because if I know what's going on, I can help you. If you don't tell me, and I don't know what this is in your mouth, I'm going to send you to have surgery. All you had to do was tell me you did the nasty last night, and then we could be done with it, right?
It'd be simple. Oh,
it's simple. Otherwise, I don't know what this is. So now I know.
Got you. But probably more people lie than tell the truth to you about things like that, right?
They try to, but like I told you, my dad was an OBGYN. So look, my conversations at dinner were a little different growing up than the average person. So I've seen it all. I've seen it all.
There was no break between childhood and adulthood.
No,
it was just
it was different.
So Joi, as a dentist, how important is a smile to you?
It's everything. I mean, people say when you look at someone, it's what you see first, and it really is true. The last 2 years, of course, being with the COVID pandemic, having the mask on is one thing, but you also have the Zoom calls where you have the cameras on, so we can still see them. And the smile is not only you seeing your teeth, but it's your expression. And so what happens is if your teeth are not, and I don't mean having a Hollywood smile, just having all of your teeth or having even the ones that we can see, if they're not healthy, it means, what else are you lacking? So not being judgmental, but that's part of your body. So you can imagine leaving your house and not even combing your hair. If you had a mask on and met somebody whose hair is all disheveled, you would think some way about them, right? So if someone smiled to you and didn't have half of their teeth, you would think some way about them. So forget what they say, you are going to judge them. So it's very important to be healthy as far as just by the appearance of a healthy smile. Forget how healthy it really is. Just the appearance of it is important.
This is very true. And, it makes me think, like, I want to assume, like, as a dentist, like when you're, dating or, anything like that, like, do you end up staring at someone's teeth, and
well, I can glance really quickly. I can glance real fast and be done with it. I don't stare. But I can see what I need to see very quickly. Yeah, okay. I don't stare at it, but I could, but I can do a very, very quick assessment in a few seconds.
Gotcha. And do they get a pass when you see someone with bad teeth, or you're like,
Well, see, I'm married, so I don't date. So my mindset is different. So I've been married for 20 years. So what I'm looking for is different now. When I'm interviewing for somebody to work with me, I'm like, you can't have bad teeth working for me. Like, it's kind of like me. I wouldn't work at a gym. You wouldn't hire me to be a fitness instructor, right? So if you have bad teeth, it's kind of like back to the hair. You wouldn't hire somebody whose hair is never combed to work at a hair salon.
Got you. The representation.
There you go. There you go.
Got you. So you're definitely not hiring someone with missing teeth, a black tooth.
I can't do it. I'm not. You. I'm just telling you.
Got you. Even if their resume and everything was on point.
No. Because you had time. You had time to get that fixed before you saw me.
These are facts. These are facts. I like that. It actually makes a lot of sense. You're not going to hire someone with scruffy hair to do your hair and expect it to be good. That makes
exactly.
sense. Yeah.
It's not.
And congratulations, by the way, on being married for 20 years, you said?
Yeah. Thank you.
Yeah, congratulations.
You're welcome.
Um, so I was thinking about this, but how relevant is the tongue to dentistry? Do you skip over the tongue, or does the
Oh
tongue?
no, it's huge. Like the tongue can tell me a lot. For instance, one, the size of it, like it back to sleep apnea. If it's too large, it can block your tongue. I'm sorry, block your airway. And then for me working, if your tongue is too large, it's hard for me to even work in there because it's like all over the place, right? Then also when you don't have any teeth, your tongue is a muscle, believe it or not. Okay. So when you don't have any teeth in the back, your tongue actually expands because your tongue grows, your teeth kind of constrict or hold your tongue in place. Okay. So if you're missing these back teeth, your tongue grow into that space. So it's like it's all over the place. Right. And then, by looking at your tongue even holds bacteria. So if your tongue is really, if you were to stick your tongue out, I could look at it and say, you don't clean your tongue, or you do clean your tongue, because your tongue should be one nice pink color. Okay, so if you look at your tongue in the mirror, if it's even like a light yellow, if it has some beige or some brown or some black, that means you're not cleaning your tongue or something's not healthy about you. If you're a smoker, you probably have dark spots on your tongue. However, if you're African American, Asian, or Hispanic, we have melanin in our skin. So our tongue may have those melanin spots. We can't get rid of that. But I mean the dark stuff that can be removed, like the bacteria, the broken down food particles, those things can be removed every single day. So if your tongue is not pink, aside from the melanin, that means you're not cleaning it properly. And that's what's called bad breath. That's where it comes
And
from.
it comes from the tongue.
90% of bad breath comes from the tongue. 90%. Some come from the gut, meaning if your acid reflux can cause bad breath, if you have enlarged or infected tonsils, if you have postnasal drip, sometimes the medications you're taking can cause bad breath. But 90% of it comes from your tongue and not cleaning it properly.
Gosh, yeah, not scrubbing it. Wow, I never knew that people with melanin, it actually appears on their tongue.
Because it's skin. So you have the skin is not just on the outside, like even the palms of your hand, that's still part of your skin, right? So those, that's part of your skin. So people may have a darker color pink on the tongue, even little dark spots, that's still melanin.
Wow.
Yep.
Wow. So you're saying the tongue is skin? Did I hear that correctly?
The tongue is right. It's a right. You have different layers of skin, right? So if you can touch it, that is skin. That is skin. Not this hard skin out here, but it's still skin.
On the inside, right? So so is gums considered skin too as well?
Gums is skin as well.
Oh, mind blown.
It's all good. It's all right.
Mind blown. That is a mind blown. Wow. So Joi, I heard this thing, and I first heard it on an episode of Seinfeld, and then someone else also asked me this question, and it's about the professions of dentist, right? I want to know if this is true, and maybe you can help me answer this.
Okay.
And they said that out of all the professions of high doctor skills, I guess there's a big suicide rate for dentists. Is this a true statement?
Yeah, we're number one. It's true. It's and I get it. So first of all, no one likes coming to the dentist. So if anyone's out there listening, please stop telling your dentist, I hate coming to the dentist. We don't want to hear that. And I swear I hear it every day. Okay. So no one wants to come to the dentist anyway. And then the majority of the time, people come to us already in pain, but they blame us for their pain, right? So they don't want to come. They come in pain. And I don't care unless you're just into crazy stuff. We don't like to see people in pain. That doesn't make us feel good. Okay. So we're already seeing you in pain. And then to fix your problem may cause some more pain, right? So you're leaving in pain. And then you got to pay us. And then you don't want to pay us. And then you're complaining. So we hear all these things. And then as dentists, we're perfectionists. We're working in now mind you, we're working on very small parts of your body. The teeth are about this big, they're tiny. And we have to work on those things all day. We're bent over every day like this, and we're working. And then it hurts. So it's not a good feeling, because it's like we want to help, but it's not it's a thankless profession. Let's put it that way. And so when the results aren't perfect, and if someone doesn't have if someone's not really grounded in knowing the outcome, like I'm fine personally, but I get it. I do understand. I do. It's long hours. You're hunched over all day, every day. You're working upside down. You're smelling bad breath every day. People are complaining. They're moving around. You have those big old tongues in the way. You're dealing with staff. You're dealing with this, dealing with that, and then they're hurting. They hate you. They tell you they hate you. It can be very hard on your spirit. So it's true.
Wow.
Yeah.
That is wild.
Mm-hmm.
That is so wild. So every day, wow. I think it's a good thing that we're talking about this, because maybe we should, I think the things that we talk about help bring awareness to them.
Right.
So we need to, people are out there talking about let's look out for the homeless and protect the homeless people. But there's also a profession like dentistry who's also having their own suffrage that we should also look out for too.
Exactly.
Right? So is there like a phone number or a place where like dentists can go and like conversate like AAA?
Well,
Is there a thing?
well, the good thing now, with the I guess they added on social media because it's been out for a while, but there are lots of groups, that we not go to, but we can talk and vent. But unfortunately, that's not enough for some people. Everybody has their own mental state. So like I told you, my dad was a physician, and I remember him telling me this was years ago when I was still in dental school, and he was talking about when he was in med school and how they did their rotations in different specialties, and he had his in psychiatry, and he told me, Joy, I think he used to, back then it was like 60-something% of people just overall had some type of mental disorder. I was like, that you're crazy.
Wow.
That's high. No way. But I believe that. And I don't mean that in a negative way, meaning they're like, woo, but I mean some type of mental deficiency of some sort. And, as a child, you grow up thinking you want to be so-and-so. You want to be an astronaut. You want to be a musician. You want to be a football player. You want to be a doctor, whatever it is. And you don't think about what it comes with. You don't think about the cost. You don't think about what it takes to be that way. So we're already in a high pressure field. So there are outlets for us where we could talk to each other, but even that might not be good enough. So, we try to encourage each other. And plus, like, take breaks. Like, for instance, for me, I see patients 3 days a week. I've been doing that for a number of years. So I see patients Tuesday, Wednesday, and Thursday. On those other days, I can, try to exhale if I need to, because it's very difficult. But you have to take care of yourself, and that's for everybody. I don't have any children, so that's not my outlet. But as far as just enjoy life, and then come back to work. Separate work and home. Find an outlet where you can just don't do that. But it's very difficult, especially if you own your own practice like I do. It's very challenging. It really is.
That makes sense, and I agree with you. People need to like decompress and have some time to themselves so they can come back better. And that might be another issue, right? People are just like working,
Right.
and then until they explode, I guess you can say.
Exactly. You have to be able to release.
Oh man, wow.
Right.
Well, I hope whoever is a dentist that's listening or inspiring dentists to listen is to seek help if you need it. Talk to people that you can talk to, maybe a psychologist if you need to, a therapist, and realize that in order to be the best person you can be, you got to take care of yourself as well.
You do.
So Dr. Joi, what would you say is the most important teeth maintenance or mouth maintenance that someone should do?
Back to the basics. Brush and floss twice a day. I promise you, if people did that, hey, it'd be wonderful. I mean, believe it or not, it sounds so simple. Brush and floss twice a day. Of course, we say, reduce the amount of carbohydrates like the candy, things like that. But even if you ate candy all day, every day, if you brush and floss the stuff off your teeth, it wouldn't be there. It would go away. You would take that off, so brush and floss twice a day. If you could do that, most of your problems would be gone. Or you can prevent your problems. And I don't mean twice a week. I mean every single day. That's the basic.
Twice a week?
Look, you believe, if you saw what I saw every day, yes. I mean every single day, twice a day. Every single day, twice a day, brush your teeth and floss your teeth. You could do it.
You hear that, people? Twice a day. That's it. You can prevent so much things.
Yes.
But that gets me now curious from what you said. What's one of the worst things you ever seen in somebody's mouth?
If I told you, people really don't believe me, but it's true. So, oh my gosh, it might have been 8 or 9 years ago, and I felt really, really bad. There was an elderly lady who was being cared for by her niece, and she had dementia, and her niece brought her in, and she had upper and lower denture. She had false teeth, and she had not removed them in quite some time. And it is what it is. So I was taking care of her, and the lady kept saying that she was itching. Her niece brought her in because she said her aunt was complaining of her mouth itching. Okay, well, all right. So we looked at it, and literally she had an ant bed in her mouth under her dentures.
And ants?
She had ants.
Wow.
And she had not removed her dentures, and it disappointed me because her niece had not cared for her in that manner, where if she had just removed her dentures, she would have seen it. But then it's like, she has ants in her room wasn't, by further investigating the whole story, the home wasn't very clean and things like that. So it became a whole different, the ball started rolling with the lack of care that she was giving her aunt. And, I had to get involved with the state and, make sure her aunt was placed somewhere, because like I said, I'm not just a dentist, I have to deal with things such as like child abuse and things like that. So if someone comes to me and I suspect child abuse or even human trafficking, believe it or not, I see things like that just aren't normal. I have to act on those things. So yeah, I see a lot.
Wow, that ant story is just crazy.
But yeah, so imagine pulling ants everywhere. Yeah.
Disgusting.
Exactly. Disgusting. It was.
Yeah.
You weren't ready for that one. I know you weren't.
I was like, hey, something's gonna happen. I asked for it, but this, this also leads me to ask, like, how can you tell that someone's trafficking children through their mouth?
Well, not necessarily their mouth, but just the person's behavior. So like I said, think about it. I'm dealing with a tooth that's connected to someone's face. That face is somebody's head, somebody's body, it's a whole person. Yes. So when I'm speaking with someone, I'm not just saying open, I'm speaking with someone and having a conversation. And so I'm looking at the whole scenario of who that person is in my chair, who brought you in, and we have to learn to listen. So when it comes to, I'm everyone's village. Like I told you earlier, I'm like the auntie, right? So if you come to me and your child's in the chair, for instance, the children come back to me without their parents. So because I don't allow, but the child comes back alone, so I can treat the child, because parents are normally too involved and they talk too much, all that kind of nonsense. Well, if the caregiver who's bringing the child back is very adamant and very just demanding, like, no, you can't bring this person, and that person is 18, 19 years old, like, that's weird to me. It's already weird. Like, this is almost, so look at the whole scenario and know how to act quickly and know how to handle those situations, and just listen. A lot of things in business, just as a business person, we become better by listening and not just chasing the dollar. And though, I don't treat dollars, I treat people, and then the dollars will come. So that's what helps me.
Wow. That is an amazing line. I don't treat dollars, I treat people. You got to put that behind you on the wall. Behind you on the
Uh-oh.
wall.
Uh-oh.
That's a
I might
great
have to.
line. You have to. That's a good line.
I'll
Remember that,
do it,
Joyce.
but let me write that down. Let me write that
Yeah, write
down.
that down.
I got it.
You got it? You remember?
I'm writing. It's
Yeah,
done.
I don't treat dollars, I treat people. That is a gem.
I
And
like it.
I it seems like two things. Like I feel like you have to learn that from experience. I don't feel like they
Mm-hmm.
don't teach you that in school. I feel
I
like that's not
don't.
a school thing they teach you. That's something from experience
Mm-hmm.
because I'm assuming most people assume like, okay, you just sit there, look in people's mouth and leave. But no, you're like they're a person. I like how you broke it down. It's like the tooth's connected to the mouth, connected to a head, connected to a body, connected to a life.
Yeah.
And so it's amazing to hear your mindset about that because maybe your mindset's like that, but who I can't say the next dentist's mindset's like that, you
Exactly.
know? So
Well, my
thank
dad
you.
taught me that. I got it from my
Mm,
father, and my it's part of your being. Meaning, you can't some things that you can't learn, and also you can't. It's your character. So
mm-hmm.
forgive me, but if you're an asshole, you're an asshole, right?
Period. Yeah.
You can't un asshole you, right? So my dad
Yeah. Yeah.
always taught me. He said, Joy, as my dad being a physician and as a surgeon, he said, I don't care how good you are with your skills. If your bedside manner sucks, you're not going to get anywhere. You have to have good bedside manner. You have to
Mm,
touch the people. And he was, as he got, advanced in his career, he wasn't in love with like the computers and how they had the tablets and the young doctors who he would teach. He's like, stop, put the computers down, turn, look at the patient, and put your hands down and talk to them. So if you look now and just pay attention, if you listen to me, if you go to your physician now, does your physician even touch your body? Most of them don't even do it anymore because they're typing in your
okay.
symptoms, they're typing
Yep.
in everything, and they're looking at the computer
Yep.
for the answer.
Yep.
There's no
Mm,
more human connection. The human touch is gone now. It's not there
mm,
anymore. So and that's what we're missing now with society, especially when it comes to an in-person service industry. The connection is gone. No one looks up anymore. They're typing on their tablet or on their device, getting the answer. Well, the answer is here, and it's here, and it's here in your eyes and your head and your heart and your ears. So if you listen and you see things, you'll get the answer instead of typing it. So he said, if your touch is in there,
mm.
if your bedside manner is not there, you're not gonna be successful. You might have money in your bank, but you're not gonna be successful, and that's a difference. That's a difference.
Wow. It's so true. You're
Mhm.
100% right, Joe. You're 100% right because um if we're not having that human to human contact and communication, then we might as well just bring the robots in right now because
There you
you're
go.
basically a robot,
Hmm.
you know? And it's the intuition of a human being that separates
Hmm.
us from the machines. But if you're just gonna be a machine, then might as well bring in
Exactly.
Wally. Might as well bring in Wally.
Exactly. There you go.
Wow. I want to give credit to your father for bringing so many great lessons to you.
Yeah.
I gotta from the beginning of this interview up till now, he's constantly been coming out of your mouth and praising him. So I can see he
Yeah.
did a great job with his daughter, and he was a great
Yeah.
man. I can just tell. I can
Yeah.
just tell. So all praises and due to him for everything he's
Definitely.
done.
Definitely.
Um, so I wanted to ask you, as a dentist, what is your favorite part of being a dentist?
Oh, I don't know. Honestly, I love the business part of it. Really, I do. I
Mm-hmm.
love the administration. I love business. I love being an entrepreneur. I'm really good at what I do as a dentist. I really am. But I love the entrepreneur part of it. But if it came to the clinical part, I love it when I can see a result. I love it when like if someone came like with crooked teeth and then they're smiling now and they're sending me the pictures. I love it when they come to me and say, "Hey doc, I got married. Look at the smile you gave me." So it's the results. It's the increase in self-esteem that someone has now from used to come to me and they would cover hands, cover their mouth with their hands. Or a lot of times I see, believe it or not, the men that come and they used to douse themselves with cologne because their breath was not, the breath smelled bad. And so now that I've taken care of their malodor, their breath, I've taken care of their gum disease, they're not covering up the stench with cologne. And I tell them, hey, remember that? And they would say, yeah, you know what? You noticed that, you told me that was going to happen. And now it's true. So the transformation from not just the cosmetic, but from the unhealthy to the healthy, and seeing how that has changed the personality of that person, how they have really become a different person. That's what I love the most.
Gotcha. You're basically like bringing their confidence back.
Exactly.
Awesome. You're like a beauty maker, basically.
Yeah, from the inside out, that's what we do.
I love it. I love it. So Dr. Joi, what projects are you currently working on, whether it's in dentistry, entrepreneurial stuff, outside personal? What currently things are you currently working
Oh
on?
my goodness, I can do that forever. Well, one of my main things, my main passions is that foundation that we have, the Freemont Foundation. And the day after my father passed away, we actually started the Fremont Foundation, and we did that because he actually went to Southern as well. My mother did. Actually, my brothers and we all went to the same school, and he always wanted to have a foundation. And we started the Fremont Foundation after him, and that was in 2013. And since then, we have sent 74 children to school. I say children, but they're young adults. So we have scholarships, and we actually give scholarships to students going to HBCU. So that's really my passion. So on weekends, I'm not just on weekends, but I'm the chair of the board of that. And so we run that foundation. It's a legitimate nonprofit, 501c3. And so it really is a full-time job, but hey, it is what it is. It's what I do. So that's my main passion, making sure that we give the students who need money to go to school, we raise money for them to get there. Because my father, once again, here he is again, he wasn't able to, well, he finished school, of course, obviously, but it was one year he wasn't able to go to school because he didn't have enough money. And his parents had to raise money to get him back in school. And so we want to be that gap filler for some of those kids, so they won't be without, because there are people out here who are just geniuses who can't fulfill their destiny because they can't attend school. So I know for a fact everybody's not supposed to go to school, they can't go to school, but for those who want to go to school, we're there for them. So the foundation is my baby. I love it, and I'm going to continue to make his light shine through me and through my family and through the kids around the nation who bear the name Fremont Scholars. That's what I do.
That is awesome. And it's called the Fremont Foundation.
FremontFoundation.com. That's it. It's simple. Everything about me is pretty simple. It's straightforward. So Fremont Foundation. Yep. So that's us.
Awesome. And you do it every year, you said?
Well, we do it year round. Every year, our biggest deal in September, we have a 5K. That's our biggest fundraiser. So it's coming up September 24th here in Atlanta. And it's a virtual, because we became virtual during the shutdown. But so this year we've added the virtual to our in-person. So we're doing a hybrid, virtual and in person. It's really, really nice. People come from all around, because like I said, my father not only was a physician, but at time of his passing, he was not retired. He was actually working. He was the chief of staff at the hospital around the corner from me. So he was a very active member of society. So, the doctors come out. And so, it's a big deal, not just for him and his memory, but as it's grown through the years, we have the radio stations come out. It's really, really huge. And so I love it so much because it's not about me at all. It's about the kids. And I keep saying kids, but I feel like I'm a kid myself. So I'm aging myself.
Yeah.
But
we all kids.
We're all kids, but I love it so much because I'm doing what he wanted to do. And I'm making sure that if I did nothing else but to honor his name, that's what I'm going to do.
Oh, that is fucking awesome. That is effing amazing.
Thank you.
So Joi, as we see that, we're honoring your father's legacy, or you're honoring your father's legacy, what would you like your empire or your legacy to look like 100 years, 200 years after you have passed? What would you like your empire to have looked like?
I want people to know that it's not just about you. Whatever you do, and I mean from the time you wake up to the time you go to bed, everything you do impacts somebody. It impacts somebody, no matter if it's you waking up and brushing your teeth. If you don't brush it, you're going to offend somebody with your breath. I don't know, but everything, I mean, put a smile on someone's face. Don't go out there with the bad mood, because you're gonna end up offending somebody. Make sure you know that your life matters to somebody. Even with this podcast, you are not connected and you actually not said yes. So that impacted you in some kind of way. So be the yes to somebody. You're not gonna gain anything by being, like I said, once again, by being an asshole. Be nice to people. And that's just the basics of life. So if no one remembers Joi Freemont for anything else, but just by being nice and by being a giving person, that's what it is. I'm fine with that.
I love that. Be a yes person.
No,
Yes.
I didn't say a yes person. I said a
whoops,
nice person.
whoops,
See,
whoops,
if you're a yes person, if you're a yes
Uh-oh.
person, it's something different. Be a nice
Gotcha.
person. Because if I said yes to everything, I would be spent, right? But be a nice person and give back. It's like, why not? If you can do it, do it. You can, but make sure you win in the end, though. Now, don't be a pushover. That's what I like that.
I like that.
All right.
I liked you. Be nice, but don't be foolish.
There you go. There you go.
I love it. Awesome. Dr. Joi Freemont, thank you so much for coming on the podcast.
You're welcome.
It was lovely speaking with you. Can you please tell everybody how they can reach you, how they can support you, how they can get their teeth looked at, how they can be part of the foundation, how they can know about your other entrepreneurial endeavors? Can you please let all the audience know about it?
If you had to Google me, my name is Joi, Joi. So it's not with the Y. So blame my mom for that. So it's Joi, Joi Freemont, Freemont. That's 2 E's, unlike yours with the 3 E's. So it's Joi Freemont. But if you were to find me on social media, it's Freemont Dental, FreemontDental. That's across all social media platforms. And if you're in Atlanta, you can always come by and see me. I'm at 606 South Central Avenue in Hapeville, Georgia. That's right next to the Atlanta airport. So if you fly in, stop by and see your girl. My phone number is 404-761-1659. And for the foundation, every year we give out scholarships now, okay? So the email address is info@fremontfoundation.com, but the website is fremontfoundation.com. You can get everything you want to from that website. Please, if you are a student, know of a student who needs money for school, please follow us, email us, and please donate to us. It's tax deductible. fremontfoundation.com. We would love to support you as we support others. And that's me in a nutshell.
Love it. And there it is, folks. And I'll have all the information in the bio, ladies and gentlemen, to find out everything you need from Ms. Joi Freemont. And I want to thank you again, Doctor, for coming on the podcast. Appreciate you so much. Everybody, thank you for listening. We appreciate you. Without you, we wouldn't be here. So thank you so much. Again, my name is Antonio The Miles. This is The Empire Podcast. You can find me at that is him on Instagram and TikTok. If you want to support the podcast, you can go to CashApp, The Empire Podcast. I got an ebook coming out very soon called 10 Things That Your Parents Should Have Taught You But Didn't. Please like the video, share, subscribe, comment. And other than that, ladies and gentlemen, again, thank you. But other than that, we'll catch you in the next one. Peace. Say it's my duty. Yeah. Is it my will? Yeah. To do what? Yeah. To do is right. I say.
But thank you. I appreciate you. That was good.
Yeah.
You did a good job. I'm excited
Yeah.
for you. Yeah, that was good.